Aaron is your fun little 4-year-old. He is all boy. He likes to wrestle. He likes to give hugs and kisses. I did too. See you right there.
1 second, he'll be cuddling up to you, and next thing you know, he's got his arms wrapped around your neck trying to take you to the ground and wrestle. And
he loves to hug. He likes to run and dance and play. And he loves swimming.
He's just a all-around awesome kid.
So even though Aaron looks like a typical little boy, he does have challenges that make him very unique. My name is Jennifer, and my son has Smith-Magenis syndrome, or SMS.
Aaron was actually a big baby. Our pediatrician at the time just kind of came out and said he's got some features that are concerning.
We're getting closer to like 6-8 months where babies should be babbling and talking and sitting up, rolling over. Aaron wasn't doing any of those things.
Unfortunately, the symptoms are not really super recognizable or associated with SMS. So often the kids will have low muscle tone, often they'll have dysphagia or trouble swallowing. And usually those are sort of the first symptoms that these parents will pick up on.
Most patients with Smith-Magenis syndrome have differences in the vision. Myopia is very common, and high myopia is very common. So that's nearsightedness.
The neurologist told me that unless we agreed to do genetic testing, they would not do an MRI on him. So we said, sure, no big deal. We'll do it. You're not going to find anything.
Just wanted to get ready and prepared for what we had to do to give him his best life.
The MRI came back with abnormalities. He has larger ventricles than he should, and his corpus callosum doesn't go all the way down to the spinal column, so it does not connect the left and the right brain. So one day at 17 months, I was working from home, and I got a phone call from the geneticist assistant, and I'm thinking I'm about to get results that there's no big deal, everything's fine. And instead she starts talking about your son is missing a portion of his 17th chromosome, and it's related to Smith-Magenis syndrome. And she starts going on to list off all the different things that are associated with SMS, all while I have Aaron crying and screaming next to me, and I'm crying and trying to hold it together, listening to her tell me everything and writing it down. It was devastating. I just started crying. She actually started crying too. Brian's on the phone with us, listening to it all, and I just saw our future shattered. It's gone.
50 to 75% of children with SMS have features of or a full diagnosis of autism spectrum disorder. So there's developmental disability, intellectual disability, autism, difficult behavior. This is an extraordinarily difficult disorder for a family to manage. And it takes not only a village, but a very kind and caring and thoughtful village.
I reached out to the community that we were told to, called Prisms, and it is a large online community of parents who have been doing this for 40 years. There is a Facebook group, and we started asking what questions do we need to ask the doctor? Is Aaron going to go to school? Is Aaron going to be able to talk? Is Aaron going to grow up and get married and have children and have a normal life? And she told me pretty much don't count on it.
Speech is a big part. He doesn't really speak. He says a few words. And we're kind of getting to that point where we almost have our own language. We can understand what he's saying. Everybody else has no idea. But he uses a speech device, so that helps.
Sleep in Smith-Magenis syndrome is always one of the top concerns for parents. It's usually not until kind of their early childhood years that we really start to see the symptoms show up. And really the hallmarks of sleep disorders in SMS are frequent nighttime awakenings, early morning awakenings, and then these daytime sleep periods.
From the time he was born until now, he has never slept for an entire night unless he is medicated. He would wake up every 2 to 3 hours. He would wake up screaming, and if you wouldn't go in there, he would begin banging his head, biting his hand, basically waking up the entire household. J and K are about to cry. L is knotted like a tie. So silly.
The issues with the sleep disorders in SMS really come down to the genetics. So the RAI1 gene, a lot of its down-regulated genes are all involved in the circadian rhythm control. And so with that disorder, there is a inversion of the melatonin cycle. And so they lose that ability to sort of regulate and reset their circadian rhythm.
When Aaron was 2, we started talking with his doctor about what we can do to mitigate some of the sleep issues that we are having. Because, no one in the house is sleeping, and with being on the road as much as I was, it's just not safe. Aaron could get out of his crib. He could run around the house. He could open the door. He could have gone and started the oven or the stove, or worst case, get out of the house once he learns how to open doorknobs properly. And it's not healthy for anyone in the family to not be getting sleep because Aaron is making so much noise. So we started talking about the different medications he could take. He told me to start giving him melatonin, and that would work for about 4 or 5 hours, and then we'd have to go in and redose him. And since then, we also have gotten a medical bed for him, and it has been a game changer for us as far as sleeping is concerned, along with the medication.
Stand up.
Oh no!
Power bomb me.
Abigail is an amazing big sister. She is the most fun-loving kid. She starts talking about, I'm going to be a doctor, I'm going to be a therapist, I'm going to help him. She's a great kid.
You ready? So Abby, she takes charge. I feel like almost half of the developmental success that Aaron has had could be attributed to his bigger sister. She's always there reinforcing what we're trying to teach him. And for the longest time, she was really the only other, I guess, peer age kid that he could communicate with that wanted to interact with him.
Say sister?
She doesn't see him as a special needs kid. That's her brother. Man. Like I'm just really proud of her.
Good night.
So Aaron is in a best case scenario. His parents are super supportive. He's got a great network. They're very on top of things. And so his family is doing all the right things.
I hope that I can live to be one day longer than Aaron. I hope that he can live a long, full life, but I don't want anybody else to ever have to care for him. I want to be the one to take care of him for his entire life and not put a burden on anyone else. I am on the fundraising committee for the Smith-Magenis Research Foundation. Our goals are to continue funding the labs that we have across the US and one in Canada. It's all been parents like me, parents that took the initiative to start something like the SMS RF, and we just hope to change the future of families like ours.
Well, you gotta keep the family unit together. And we gotta be strong. He's different. He has issues that other kids don't have. And it doesn't make him any less of a kid. And so you really just gotta be optimistic. There's so many kids that have such worse conditions that it puts it in perspective. You start counting your blessings.